Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here am I today with a special guest, and I'm here with Dr. Nour El Hoda Ezzeddine. Hi, Nour, it's so good to have you here today.
Hi, Kristen. Thank you so much. So good to be here today as well. I'm so excited.
You, of course, have a presentation for us at the Gold Lactation online conference, Pharmacological Strategies for Navigating Diabetes in Breastfeeding Mothers. I'm very excited about this topic. Now, before we go into the topic a little bit, why don't you tell us a bit about yourself? First of all, where in the world are you located?
So I'm located in Lebanon, and I'm born and raised here, and I'm exercising my passion in both pharmacy and in lactation, and combining the best of both worlds.
That is beautiful. So you have a doctorate in pharmacy and you're also an IBCLC, is that correct?
Yes, that's true.
Beautiful. So, I mean, that is a beautiful combination because how often do we get the question from our parents or mothers that are breastfeeding that they are worried about what medication can I take while breastfeeding, right? There is a lot of questions all about that. So you are the right person for these kind of questions. And yeah, so tell me a little bit about what are those questions that are usually coming up when you work with clients in the field?
Yeah, definitely. So it's not up to me to prescribe or to recommend
Right.
any medication, but definitely being a pharmacist, it's an added value to check the compatibility of a medication with breastfeeding and to share this information and the evidence with mothers and with the physicians for them to take informed choices about their treatment plans. So we often receive a lot of questions about the compatibility of medication with breastfeeding, whether directly from mothers, but also from other lactation professionals whenever something is a little bit complex. But I think what saddens me the most is whenever we encounter lactating parents with that received any sort of bad advice about whether to
Mhm.
stop breastfeeding or to pump and dump their milk for whatever amount of time, or like just for the sake of taking a certain medication that really often it's either compatible with breastfeeding, or sometimes we have a very good alternative that is safe for breastfeeding mothers and for the infants, and it's a very good therapeutic option as well. So
Mhm.
I think this is the part that breaks my heart the most, and
Mhm.
this is why I really put a lot of passion into spreading more information about the compatibility of medication with breastfeeding among peers and other professionals as well.
And it is important because even to this day nowadays, you get a lot of advice from healthcare providers, physicians, even saying like, oh, don't breastfeed, if you're on that medication, without even knowing, is that really true, that information, right? Like it's always like we need to err on the side of caution. But then really, I feel like there is a lot of education needed for healthcare providers too, to,
Yeah.
really um, be on board with that and to be educated about what are really the effects or not about that. Now, your topic is about navigating diabetes in breastfeeding mothers. It's a big topic and so important, right? What would you say are some of the common misconceptions about breastfeeding while managing diabetes, and how can we address that?
I think like you said, that it's kind of a complex topic because it has many aspects
Mm-hmm.
about like how would diabetes on its own impact the mother, how it can impact the breast milk production as well, and how it can impact as well some delivery and postpartum complications and challenges, which in return can also impact breastfeeding. So it has a lot of layers, and like each turning point can have a negative or a positive impact is if managed correctly on breastfeeding specifically. So I think one of the at least in around me, one of the most common misconception is that if you have diabetes or gestational diabetes, you will have a baby with hypoglycemia, and you cannot exclusively breastfeed in the hospital. They have to receive supplements. It's very dangerous, and so we see it a lot as an advice, whether from the community or even in some hospitals.
Mm-hmm.
And this is not the case. We know that practically it can be prevented through proper breastfeeding support and management when it's done by an IBCLC early on in the hospital
Mm-hmm.
and with a very close monitoring for the cases. So, and we also have other misconceptions as well that we will try to tackle as much as possible during this presentation.
That's fantastic. Thank you. I can't wait for that. I got a little sneak peek. I have to tell the audience, it's going to be wonderful. You get so much detailed information about management and such. So it's going to be fantastic. Yeah, and you were so right. In the hospital, if there's somebody with, let's say, gestational diabetes, the baby is born, it's maybe on the bigger end. The first thing I often see is that, oh my goodness, it's we have to prevent the baby from being jittery. We need to give formula right away because of the, what you mentioned with the hypoglycemia. When there is really it would be so much better if we had good lactation support right away, right, in these cases, or we could prevent a lot of harm that could be done in just like throwing in formula and jumping to conclusions, right? Speaking of gestational diabetes, that there are some risks that somebody with gestational diabetes may develop type 2 diabetes postpartum. What is, I don't know if you can speak to that, or what is your recommendation also with regards to management and lactation?
Mm-hmm. So, yes, studies have actually linked gestational diabetes with the development of type 2 diabetes. It's not directly in the postpartum period, so
Mm-hmm. Right.
it's not directly after delivery. Usually, gestational diabetes disappears when a mother delivers and she goes back to normal glucose levels postpartum, but it is a risk factor of developing diabetes type 2 later in life, and even other metabolic complications. So we also know that breastfeeding is a kind of a protective factor because it improves glucose metabolism, and it lowers the risk of developing type 2 diabetes later, specifically if a mother already had gestational diabetes. So this is the population that really benefits a lot
Mm-hmm.
from actually breastfeeding in terms of preventing the development of type 2 diabetes. Yet, uh, in the studies, it showed that also women with gestational diabetes are women that struggle more than the general population in terms of probably kind of mismanagement. So sometimes they are offered supplementations.
Yeah.
Uh,
Mm-hmm.
uh, so so they need this support early on to be successful in breastfeeding, and they can do it. They can absolutely succeed in breastfeeding, whether they have gestational diabetes or even any other type of diabetes, whether it's type 1 or type 2. With the right amount of support, they can
Mm-hmm.
succeed in their breastfeeding journey.
And that is so important. And what you mentioned there, like that how breastfeeding can possibly prevent, just diabetes later in life, is such a important educational information that I think as healthcare providers and lactation, counselors, IBCLCs really have to talk about more, right? Like I feel like this is something we need to bring in like early on, even in prenatal classes when we have, breastfeeding classes prenatally and such. So because these are great benefits, and I feel like we never, or we never, but we might not talk about them enough. And I feel like
We
it's
rarely
right.
do. Yeah, that's true. Probably in prenatal session, the focus is mostly on other
Yeah.
preparatory talks. Sometimes complications are mentioned, but rarely diabetes or gestational diabetes in general. You are totally right on that.
Now let's speak about diabetes medication and breast milk. So, I mean, that will be your focus there in your presentation, of course. I mean, of course, many people are curious about the side effects and what does it do, how much does get in the milk. Are there any medication that's safer than others? I mean, obviously, these are valid points. Could you just briefly touch on those?
So, yes, in my presentation, I will go deeply into the pharmacokinetic profiles and how to assess if a medication is actually safe to be used in breastfeeding mothers. What are the key considerations for drug safety, and specifically for glucose lowering agents or for diabetes medication. So some are actually safer than others, but the important takeaway or key message, I think, is that we do have very good options. So we have
Mhm.
good drugs that are very well studied with extensive data and that are considered safe to be used in breastfeeding mothers. And there are many options available.
Mhm.
So even if we encounter a drug that perhaps has limited data or might not be completely compatible with breastfeeding, we do have other options that are available and that are good to achieve the therapeutic goals as well.
Wonderful. Now, I know you practice evidence-based. You dive deep into the research in your presentation as well. Are there any research gaps? Is there anything in research that you would like to see that is maybe understudied, or do you feel like this is an area that is pretty well researched and studied?
Um, I think breastfeeding overall is not an area that is very well studied in general, to be honest. So there is a huge area to improve and to have more data and more studies that
Mhm.
are directed towards breastfeeding. I think we are doing better lately. So we have a lot of studies that are coming out recently, and specifically to medications, like as you know, um, um, I think we are also behind on that specifically because yeah, it's not something that is asked from the companies to when they develop any drug to actually perform any kind of studies worldwide as kind of a regulation
Mhm.
to study if the transfer of these drugs into human milk. So we gather whatever evidence that we have, the practice, the profile, the reports, the monitoring, and
Mhm.
this is how things are managed. And once we have like some good base, sometimes studies are formed and they build on this base. But of course we have a lot. If you see, you check the references, we have a lot of molecules with the limited data that is actually available, and it would be good to have more research in this area as well.
Great, fantastic. Thank you. Noor, before I let you go, any final words you want to leave our viewers with today?
So I think if I want to just sum up, or before we go, I think like I would share really my passion towards advocating for breastfeeding and to encourage all of the viewers to really dive deeper into the material. I know that pharmacy is very dry and it's sometimes hard to grasp. Sometimes we think that we know it all, but we always have room to grow and to grasp some new information and to develop our knowledge in these topics, especially if we come from a different background. And this is a topic that is very important for breastfeeding diets. And yeah, unfortunately, the situation now is that it's really up to us, the lactation professional, to advocate for breastfeeding diets and to play the role of mediator in terms of sharing the evidence base and the information and studies that are available, because no one else is doing this job. And we have a huge responsibility. It's not even shared. It's a responsibility that we are only taking on ourselves. So I hope that they find this presentation useful, and they can learn from it as well.
Well, thank you so very much for being here with us today. Your passion, really, I can hear it in your voice, and it's wonderful, the work you're doing out there in your community, and serving those families there, and bringing the education here at Gold. Thank you so very much for that.
Thank you for having me here as well.
And now some information for our viewers. Dr. Nour's presentation, Pharmacological Strategies for Navigating Diabetes in Breastfeeding Mothers, is part of our Lactation online conference of 2025. Yes, it has started. It's a fantastic conference, and you can still be part of it if you have not yet signed up. Go to goldlactation.com to find out more about all the presentations there, and any information you might find useful there as well. Thank you, everyone, for watching. Have a lovely rest of your day, and I hope to see everyone at the conference. Bye-bye for now.